Hello and welcome to my presentation on the physician assistant profession, a primer for high school students. What is a PA? A PA is a medical professional who, in collaboration with a physician, can evaluate a patient's condition, diagnose, treat, and prescribe medication, perform many medical procedures, up to acting as a first surgical assistant, respond to medical emergencies. In some states where there is a shortage of primary care providers, or PCPs, PAs function as the PCP. The name of the profession is currently being changed to physician associate to reflect our more autonomous and expanded role played by PAs. In Australia and the United Kingdom, the name physician associate is already used. PAs work in hospitals, clinics, some of them are wellness providers, and some of them work on cruise ships and in the military. So, a brief history of the PA profession. The position was born out of the Independent Duty Corpsmen established by the Navy in 1944. The corpsmen rendered medical care on submarines, ships, and remote areas without a medical officer present. So oftentimes on submarines and ships or in remote areas where there was no military physician, the corpsman was the own or sole medical provider. In the 1950s and 60s, civilian physicians recognized the unique skills of corpsmen and hired them to assist in their offices. The first PA program was established in 1965 by Dr. Eugene Steed at Duke University in North Carolina. The training was modeled after the accelerated physician training program used in the military in World War II and the Korean War. Current training and admission requirements for PAs. Most programs require a bachelor's degree with the same science courses as is required for a pre-medical program. That is 2 biology courses, general biology, 2 general chemistry courses, 2 general organic chemistry courses, 2 general physics courses, at least 1 microbiology, and 1 biochemistry, along with a GPA of 3.8. Now, this is going to vary by program. This is just a general overview. Most PA schools require about 1,500 of clinical hours, meaning direct patient care hours. Some PA schools will accept things like jobs like medical scribe, where you work along with the physician or provider. So these clinical hours can be achieved either via volunteering, working, or shadowing. Most PA programs consist of 1 year of or a didactic year in which there's lecture and approximately 2,000 clinical hours across 8 specialties. These specialties are internal medicine, pediatrics, OBGYN, emergency medicine, surgery, behavioral health, family medicine, plus 1 elective like ICU, or if you're interested in a particular specialty, you can actually request to repeat one of the other clinical rotations. Training and requirements, of course, vary by program. So how does a PA training differ from MD training? They both require a 4-year bachelor's degree. However, the PA school is 27-month master's degree, which includes your 2,000 clinical hours. The difference here is medical school is 4 years. The 3rd year consists of clinical clerkships in which the soon-to-be physicians rotate through different specialties so they can figure out what particular specialty might be of interest to them. The 4th year is the internship, and The next stage of the training is a residency program, which can last anywhere from 3 to 7 years, depending on what that particular physician is interested in specializing in. The longest residency programs are those that are surgical specialties. So my personal journey, I just wanted to let you know about my particular journey, slightly different than most. So I actually got a job as a medical assistant. From medical assistant, I was trained as an EMT. While working as a medical assistant and EMT, I earned my 4-year bachelor's degree. I received further training on the job to become a cardiac technologist and also a neurotechnologist. Basically, that meant that I interpreted EKGs. Then, as a neurotechnologist, I was able to perform what's called EEGs on patients. After graduation, I did some laboratory science, some laboratory work. While it was academically interesting, I preferred patient care and patient interaction. I worked on a master's degree in biomedical science. I took many courses in pathophysiology, immunology, hematology, advanced microbiology, and earned a master's degree. At that point, I made a decision not to pursue laboratory science any further. I applied to a PA program and I earned my PA degree. Shortly after my PA degree, I earned a Doctor of Medical Science degree. Now, this is not required for most PAs. I chose to do this degree because I was interested in education. So, frequently asked questions. Do PAs go on to become MDs? No. We have our own separate profession, but you can do so if you so desire. That will, however, require going to medical school fresh. There is one program that does a PA to MD degree that I'm aware of. I'm not sure if there are any other programs in the country, but there is only one program that I am aware of, and it maybe cuts about 1 year out of medical school. So what is the biggest drawback to being a PA? Well, depending on your relationship that you have with your physician, you may not have the final say in some medical decisions, which I am okay with. The physician has, depending on your specialty, the physician has many more hours of training, and technically the patient belongs to the physician. It's if Most of the time, especially in my specialty, that's that physician's patient. So they ultimately are responsible for them and will end up having the final say. All right, so what are some advantages to being a PA? Well, you spend less time training. More of your training actually occurs on the job. And if you go into any healthcare field, or any field for that matter, that requires a large fund of knowledge, you have to be naturally curious and you always have to keep learning. Often there's a better quality of life, balanced with the ability to care for and help many patients. What do I enjoy the most about being a PA? My salary is not dependent on something called RVUs. So RVUs are revenue value units. Often, some of the physicians, their salary is tied to this RVU and it requires them to meet certain goals or volume. So I'm able to spend a little bit more time with the patients, answering their questions, explaining medical procedures, and I find that this really makes the patients feel heard. It really makes them feel cared for. That is one thing that I would say is the most fulfilling thing about being a PA. So I personally have worked in 3 different specialties: internal medicine, cardiology, and radiology. And as a PA, I could do that as opposed to a physician who has one particular specialty. The advantage of being a physician with a particular specialty and residency training is that you are the expert in that particular field. A PA can remain a generalist for as long as he needs to be. And you're allowed to switch in between specialties as much as you like or as much as you're willing to. And finally, if you have any questions, please comment. I'll do my best to answer you. I had to, if you notice the AAPA logo there, that's the American Association of Physician Assistants. They work very hard to advance the profession. So if you want any further information, you can get it on the AAPA website, or if you're interested in a particular PA program, I strongly encourage you to meet with some PAs. I encourage you to meet with some faculty members. I encourage you to check out that particular program's website and look at all the requirements for that particular PA program. So when you enter an undergraduate degree, you'll make sure that you're satisfying all the requirements of that program that you're interested in. Thank you very much for listening.